All right, this is kind of an introduction to some of the basic neuroanatomy. Over here on your right, I have the circle of Willis over the brain. So, quickly understanding the brain, you have up here, you have, this will be a brain on its side. So, there's the temporal lobe. So, frontal, here's the eyeball right there. So, frontal lobe, parietal, temporal, and occipital. And so the circle of Willis kind of fits in here, this kind of area, okay? And this is the big part of the brain up here, the telencephalon. Down here, underneath we have the diencephalon. So here's the cerebellum. And then down here we have the brain stem. And the top part of the brain stem there is the midbrain. You just think it's between the big brain and the small brain down here or something. I don't know if you want to think of it. Midbrain, and then we have the pons, and then we have the medulla underneath that. And then we have, of course, the spinal cord coming down like this. So there are all these little structures called cranial nerves that come off of here, and the nuclei are a little bit more confusing, but really basically understanding that we have mostly when we think of the midbrain up here, I'm just going to put mid, normally you want to think of the eye when you think of the midbrain, and the reason for that is that cranial nerve 3, usually these Roman numerals, but I'm just going to use normal numbers. Cranial nerve 3 is called the oculomotor nerve, and it's also associated with the Edinger-Westphal nucleus. And so it's going to have to do with most of the movements of the eye. Most of the muscles of the eye are innervated by 3, except for 6, and which abducts the eye, and 4, which is trochlear, which kind of points the eye down towards the nose. So, but most of it is 3, most of the eye movements. So when you think of the midbrain, think of the eye. The next area here are the pons. This area is one what I want you to think of the face. And for this one, cranial nerves 4 through 8 are pretty common here. 8 kind of overlaps in the next one as well, because remember there's 2 parts to 8. There's the vestibular part, and there's also the cochlear part, the vestibular cochlear. One part has to do with hearing, the other one has to do with balance. So that's kind of in between the pons and the medulla. And here's the medulla here. And the medulla, I want you to think about mostly the tongue. And the reason for that is because of cranial nerve 12. But this one has kind of a mix between 8 and 12 in it. And let me follow the same pattern as following before. So tongue, 8 to 12. And so there it is, brainstem. And so then you can kind of tie in blood vessels into this generally. Overline, or rather from the circle of Willis and below. So the circle of Willis is just that little circle structure up here, right? So I'm kind of drawing this thing over here to the right. I'm going to draw it off to this side now. So or maybe I'll draw it right over the top here. So up here, they're putting the circle of Willis kind of sideways, not appropriately put here, not sideways and sort of slanted. So that's like the circle of Willis. Underneath the circle of Willis, we have a bunch of these arteries that kind of supply the midbrain. There's a bunch of them. I won't go into all of them right now, but just know there's like the superior cerebellar, and there's all these other arteries branch off here. But below that here, we have this section shown right here, which is the basilar. And that supplies the pons. And then this thing kind of branches out into the vertebral, and that supplies the medulla. So basilar, divide this up like this. Basilar gets the pons, vertebral gets the medulla, And you can kind of tie these things together. So if you have a problem with the basilar, you're going to have a problem with the pons, which means you're going to have a problem with the face. If you have a problem with the vertebral, it means you're going to have a problem with the medulla, which means you're going to have a problem with the tongue. And all those cranial nerves and whatnot associated with. You have problems with like the superior cerebellar, cerebellar, or any of those other ones. You're going to have problems with the midbrain, which means you're going to have problems with the eye. That's kind of a general way to think of it. There are exceptions, of course. Let's go ahead and dissect some of this, the rest of this circle of Willis, and kind of talk about the other important parts of it. There is the anterior cerebral artery, and that one's up here. And where does this one go? Well, look, it's dipping there between the brain hemispheres. So you can see that and dipping in between there. And what's up in there, if we were to draw something called the homunculus, we'd see the feet and legs and whatnot up there. But we're going to go over that more in just a second. I'm going to introduce these characters first. So that's the ACA, anterior cerebral artery. We also have the middle cerebral artery, which you can see kind of coming off here, off to the side. So we call it MCA. And then we also have the posterior cerebral artery, which you can see coming off right here, the PCA. So the ACA, the MCA, and the PCA. And you see kind of they come off of these different parts, and they're going to supply different parts of the brain. Now, if we were to draw this brain up here, or do this brain on the side here, we understand that the choose another color. How about orange? So the anterior cerebral artery gets kind of this inside sort of middle front region there, and then so that's ACA, and then let's choose another color. How about green? Middle cerebral artery gets more of this side part here, and then the back part back here is gotten by, let's see, how about a nice blue, is gotten by the posterior cerebral artery. So different areas fit on different parts of the brain here, and so they're going to affect different things. Let's go over that really quickly to kind of make some sense of it. The MCA, starting with that first over here, the MCA, it has the motor cortex of the upper limbs and the face. Okay, so motor cortex, upper limbs, and face. So if you have a obstruction or something of the middle cerebral artery, you're going to have problems with motor abilities with the upper limb and the face. It's associated with contralateral paralysis, meaning that here's the brain, here's the eyes, here's a person's body, arms, legs, all this stuff. When this stuff with the spinal cord ends up, it does something called decussating, or it kind of, the stuff from this side of the body, I'll do it this way. Stuff from this side of the body goes up like this, goes that way, and the stuff from this side of the body goes up like this, it goes this way. So if you have a problem over here, let's say, then you're going to have a motor deficit down here on this side. So that's why it says contralateral problems. And so middle cerebral artery is going to have some contralateral paralysis of the upper limb and the face. Also, you're going to have some sensory cortex going on in the middle cerebral artery, and that is also of the upper limb and face. So you're going to lose some sensation and some motor cortex of that upper arm, upper limb, and face. And that's going to be contralateral loss of sensation, as well as upper limb and face. So both sides contralateral here. And then if you notice here, this was the temporal lobe. So it's kind of on the side, and you can see that this middle cerebral artery supplies some of that. And so what you're going to have in the temporal lobe is there's two areas that are really important areas. One's called Broca's area. Put a B for Broca. I'll put a B on it. See. And then there's also Wernicke's area. And these are really important for speaking. Broca's is for kind of the motor aspect of speech, and Wernicke's is for kind of understanding speech. So if you get those shot out, the person can't speak anymore. And if a person has damage to the middle cerebral artery, they may lose function of these two important parts of the temporal lobe, Wernicke's area, and I guess also the frontal lobe, the part of the frontal lobe there that is Broca's area. So I guess I should make the distinction that Broca's is more in the frontal lobe, Wernicke's is more temporal. So the aphasia, if it's in the dominant, usually left hemisphere. So if you've got the left and right sides here. So if it's the middle cerebral artery to this left side, which is usually the dominant side in people, then you're going to get something called hemi-neglect. Or excuse me, I apologize. If it's in this left side, you're going to get aphasia, which is like total loss. But if it's on the other side over here, then you're going to get hemi-neglect, which is kind of like partial. So usually the right side is going to result in hemi-neglect, whereas the left side is going to be aphasia. So think that the A is on the left for aphasia, and H is on the right for hemi-neglect. Okay, so next artery here, the anterior communicating artery. Here it is right here. This artery is for the motor cortex of the lower limb. And there's this thing called the homunculus. It's pretty silly, really. It's if you were to draw, so this is like the inner part. So here's your brain like this, right? This is like a front view, eyeballs right there. So the way this homunculus works is you can almost draw this body on here. So here's a foot, and here's the leg coming up like this. Here's your butt. Here's your arm, and then your hands like this, and then you get your eyes and your nose and your mouth like that. And then if there's damage, and this represents like where the damage is. So if we were to get damage in here, which is where the anterior cerebral artery is, what's that going to be damaged to? Well, you can see the structures here: foot, leg, lower limb kind of stuff. So anterior cerebral artery is going to cause direct damage to your motor cortex and sensory cortex for the lower limb. So this is going to mess up what's going on down here in these lower limbs. Okay. So I'm drawing yellow over this to kind of show that that's the part being damaged there with the anterior cerebral artery. So contralateral, because remember it goes up like this, it goes over to that side, so here it goes over to that side. It's contralateral hemiparesis of the contralateral paralysis of the lower limb, and also contralateral loss of sensation of the lower limb. So another artery, or a group of arteries we'll talk about here, is the lenticulostriate arteries. And these are arteries that come off one of these other main arteries. Lots of little ones, and I believe it's lots of little ones. Maybe I should double check that, make sure I'm not teaching anything wrong here. Hold on. Lenticulostriate. So hopefully this will give me a good picture that I can show here. Okay, so lenticulostriate arteries. One's going to the globus pallidus. Here we go. There's a great picture. So this little image here is kind of showing how they work, or what they come off of. So there we go. So here are the lenticulostriate arteries, and you see them coming off of here of, see, the middle cerebral artery branches into all these different parts like M1, M2, whatnot. Here you can see it kind of branching off of here, off of the horizontal M1, a little bit of A1, probably the anterior communicating, or anterior cerebral. So here they are kind of branching off of M1, and these arteries are responsible for the striatum. Well, they call it the striatum because there's a bunch of little blood vessels in it, and it almost looks like stripes. The internal capsule. So the brain has this sort of inhibition cortex to kind of help you make sure that you just don't do everything that you think about. So when you think about something, there's something kind of holding you back. Kind of one way of explaining it. And this area, basal ganglia, internal capsule, globus pallidus, kind of area, striatum, whatnot. I'm not doing a very good job describing this, but it's getting at least some exposure to some of the words. Internal capsule is actually where everything, all the little signals travel down to your brain, so that shouldn't have included in there. But anyway, the lenticular striate arteries kind of supply the striatum and the internal capsule. And so if this goes out, you're going to have contralateral hemiparesis because all the little tracts go through the internal capsule. So you're going to kind of get paralyzed on one side of your body. And see here, and any other big things to bring up here? I didn't talk about pica, the posterior inferior cerebral artery or cerebral artery. I can't remember the exact word. And that is for the lateral medulla. So down here, let's see, another color I haven't chosen yet. How about pink? So down here on the medulla, you end up getting this blood vessel that's called, they call it pica. This isn't very visible. Maybe I'll use brown instead. So you get pica, posterior inferior cerebellar artery. And pica supplies the lateral part of the medulla. And that's why there's a syndrome associated with this called lateral medullary syndrome. Another word for it is Wallenberg syndrome. And the medulla has a lot to do with cranial nerves 8 through 12, part of 8 anyways. And so if this goes out, it's kind of the cochlear, or it's the balance part, of the cranial nerve 8. And so if this goes out, the person's going to have vomiting and vertigo and nystagmus, which are all kinds of things associated with that other part of the cranial nerve 8. But also they're going to have, since the tracks for the spinal cord go up through here through the medulla, you're also going to have some contralateral hemiparesis, contralateral decrease of pain and temperature sensation from the ipsilateral, so the same side of the face. So up here would be the same side of the face, but the other side of the body. In here in the spinal cord, brainstem, is where a lot of these things swap sides. And so this is one of the areas where it's one side for the face, but the other side for the body because of where it swaps sides. So also dysphagia and hoarseness. Of course, that's associated with the cranial nerves. We've got 9 and 10, and 10 is usually the one we think of here, which are all associated with the kind of the gag reflexing and all that sort of stuff. And also an ipsilateral Horner syndrome. Won't go into that right now. So that's another thing that happened. There's also the AICA, which is they call ICA, whatever. And this is for the lateral pons. So lateral pons. So we pica down there, and then we've got AICA for the lateral pons. And this is another part of 8 as well. So you got the vomiting, vertigo, and nystagmus. But also, because you're thinking of the pons, you're thinking of the face. So you're going to get paralysis of the face. So you think down here, pica had to do with the medulla. So you can think of the tongue. Maybe they kind of think of that hoarseness and the gag reflex kind of thing. And now with the pons, you're thinking of the face paralysis. And you get kind of a facial droop and some of those sort of things. Ipsilateral decrease in pain temperature of the face, contralateral decrease in pain temperature of the body. It's because of the tracts. And haven't really discussed these different tracts yet in the body, but I'll just really lightly explain them here. So this is not a brain. This is a spinal cord here. And stuff coming in the spinal cord, stuff going out the spinal cord here. So you've got these tracts that come in, these tracts that go out. So back here is the dorsal or the back part, and sensation comes in through the back. So what kind of sensation? You've got 2 tracts here. You've got the ALS, anterior lateral system, or the spinal thalamic tract, and you also have the dorsal columns. The ALS has to do with pain and temperature. The dorsal columns has to do with vibration and proprioception. And both those come in through the back. Okay. Well, stuff also goes out through the front. What comes out through the front? That's the motor stuff. Particularly, it's going to be the corticospinal tract. Okay. So this is stuff that's coming from the brain, the cortex, corticospinal, coming from the brain, the cortex, and it's traveling down, and it's coming out here, and it's telling your hand to move, But these things do weird things when they come in and out of the spinal cord. For example, this tract coming out, they all kind of meet up here in this little area, and then they switch. Anyway, they do weird stuff. But the point is here is that ALS and DC, the anterolateral system, or the spinal thalamic tract, and the dorsal columns come in back here in the back, and then the ALS, the anterolateral system, within the spinal cord right there, it swaps over to the other side, and then it just travels up the spinal cord. So it's kind of swaps positions on the other side, and so that makes a big difference in diseases called like Brown-Séquard syndrome, which I won't go into at this moment, but that's damaged the spinal cord. Whereas the dorsal column, what it does is it goes here, it synapses here, and then it goes, or rather it doesn't synapse, this one synapsed here. The dorsal column, what it does is it goes up, all the way up here, and then up here in the brainstem, then it's gonna do its synapsing thing and then switch over. Okay, so the dorsal column, and actually the same thing goes for the corticospinal tract as well. It follows the dorsal column, so they both go up. Dorsal columns and corticospinal, even though this one's motor and this one's sensory, they go up together and they switch up here, whereas this ALS switched down in the cord. And so that's why a lot of times you're going to see with some of these syndromes where you're going to have contralateral proprioception, okay, or I guess maybe I should say better example would be, let's say with pica, you're going to have decreased pain and temperature sensation from ipsilateral face and contralateral body. Okay, so it's because of where that particular thing switches over in the tract. Lastly, what I want to talk about, I guess I could do the PCA, the posterior cerebellar artery, as I hadn't mentioned that one yet. So the posterior cerebellar artery, that's going to be your occipital cortex, visual cortex. So you're going to think vision's going to get shot out if that one goes, because of where it's positioned on the brain. So there's also the basilar artery. Remember, we mentioned this one here. So if that one goes out, what are you thinking? Basilar, pons, and face. So that one gets shut out. We're looking at messing up the pons, medulla, and lower midbrain. It's going to be preserved consciousness and blinking, quadriplegia, loss of voluntary facial, mouth, and tongue movements. They call this locked-in syndrome, where basically the only thing the person can do is move their eyes around and think and everything, but they can't really move the rest of their body. That's because everything goes right there through the pons. And I think that's enough to cover in this video. Hopefully I didn't make any mistakes. If so, I'm sorry. And maybe you can catch them and kind of learn from them. But I hope that you learned something.